So what is the prostate gland? The prostate gland is part of the male reproductive system. It's a very small gland, around about the size of a walnut. It's described as being donut in shape. It's small, it has a central cavity, and through this central cavity passes the outlet pipe of the bladder, or the urethra. So the bladder is on top, and underneath is the prostate, through which passes the urethra, or the outlet pipe of the bladder. For reasons that we don't fully understand, the older a man gets, the larger the prostate gland gets. And as a result of that, men get more and more troubles with waterwork symptoms the older they get. Part of the confusing thing is that there is no linear correlation between the size of the prostate and the severity of symptoms. What that means is, just because you have a very large prostate doesn't mean to say you're going to have very severe waterwork troubles. And in fact, many men that I see can have small prostates but very severe symptoms, and conversely, large prostates and minimal symptoms. What happens the older a man gets is that the area around about the urethra, called the transition zone, increases in size. It increases in size because there are more prostate cells, and these cells occupy more space that squeezes the pipe, a bit like a clamp around a pipe. We divide urinary symptoms into two main categories: obstructive and irritative symptoms, or overactive bladder symptoms. The obstructive symptoms are characterized by a slow stream, the need to strain to empty, a stream that may be a little bit intermittent, and also a feeling that the bladder's not quite empty when you've finished voiding. Overactive bladder symptoms include going very frequently through the day, having a real urgency and needing to rush to the toilet, and in very severe circumstances, leaking small amounts of urine because you don't make it to the toilet in time. In addition, nocturia, or getting up through the night. So part of our assessment when we see a man with lower urinary tract symptoms is to work out the degree of impact that these symptoms are having on a man's life. We assess things from an objective point of view. That involves a score, something called an International Prostate Symptom Score. And the severity on that score gives us an idea of how bad the symptoms are. And also there's a quality of life component. And from that we try and work out how much bother a man has from his urinary symptoms. And we can then get an idea of how to treat things. Some tests are required first of all. Urine tests, blood tests, some imaging, and maybe a camera test or more advanced test. So the urine tests aim to let us know if there's an infection or perhaps any blood within a man's urine, and whether or not there are any abnormal cells within the urine. Blood tests include a PSA check to assess for a man's prostate cancer risk, and imaging can include an ultrasound to allow us to get a better idea of how big or small the prostate is, plus how well the bladder is emptying, and whether or not there is any impact on the kidneys. In addition to this, some men may require a cystoscopy. A cystoscopy is a camera test. It's a flexible camera, a very fine camera, that allows us to look inside the outlet pipe of the bladder, to see exactly what the prostate looks like, and to have a look at the lining of the bladder. In special circumstances, additional tests, such as urodynamics, may be required for us to get a better idea of exactly what's going on within the bladder and the prostate. Namely, is it obstructed and is it overactive? This workup is obviously in addition to a detailed clinical discussion and an examination, including the finger test through the back passage. Depending on the severity of symptoms, a particular treatment plan will then be suggested. This treatment plan can include medication, laser surgery, a TURP, and will ultimately come down to the preference of the particular man involved.